Marissa. I just want to say a special shout out to you, Marissa, because you've been helping everybody so much during this challenge. I've been watching and I noticed. So good job. Yeah, Robert is back. Awesome. Okay, welcoming you guys. Officially, we are now streaming to the Facebook group. Latoya back in the house. Kayla here. Nice. So while we are waiting for our co-host tonight to jump on, I'm going to make a few announcements. And they're very timely and pertinent because we are going to we not only changed this session tonight, we literally like flopped everything around 2 nights ago when I think it was Kiki who messaged me and said, do you think that what we saw was Commotio Cordis? So instantly we realized that because this is a high risk EKG challenge and because we're talking about sports physicals for part of our high risk stuff, we were going to do that tonight. Then we realized we have to address this. This is a really important topic. It's on the top of people's minds. So that's why we put this class together. So Mike and I kind of brainstormed, and Mike has done this class actually for us, I think it was last year. I think he'll probably remember when he comes on. But he did the class and we thought we would give a version 2.0 and maybe talk a little bit about what happened or potentially happened. But I just want to kind of tell you first off that we do have our giveaway tonight for scholarship. And that is really, really, really important, okay? Because we're giving away Chart Healthcare Academy bought a scholarship for one lucky PA or NP for tonight. They said, we want to give a scholarship away to your 30-day EKG challenge. So I'm going to give you the hashtag. And if you could put the hashtag in now, if you are a PA or NP, I'll be picking that at the end of the session tonight. Okay, so don't let me forget you guys. I have the kit right here. Whoever wins the scholarship is going to get this kit with all the stuff. You're going to get access to our course that we're going to start live next week on Monday. It's going to start from the basics of EKGs. And yeah, Kiki, it was you and you're here. Kiki told me, hey, Jen. So Kiki was the one that kind of kicked this off, so we can thank her for putting the spark in my mind to do this. But yeah, it is an awesome gift. And thank you, Chart Healthcare Academy, for sponsoring somebody for this challenge. And I'll be writing your names in the bowl like I always do. I got my pen, writing my paper. So while Mike's talking, I'm going to be doing that. So the hashtag that you guys want to put in, if you are going to be wanting to win, if you're a PA or NP. So yeah, so unfortunately the scholarship tonight, Marissa, is only for PA or NP. They picked it. They get to choose because they're paying the scholarship. But Marissa, there's another scholarship we're giving away tomorrow night. And that scholarship, as mentioned, Marissa, I know you've been paying attention, was for somebody, it's going to be in honor of my dad, who passed away in November. And it's going to be for the most, I'm calling it the Helpful Citizen Award. So if you've been in this group, and I've been watching you guys this week, and you've been in this group and you've been helping other members of our group find things, navigate, if they're having confusion, helping them, that's what my dad did. And that person, whoever does that the most, is going to get that scholarship tomorrow night. So hopefully you guys will tune in and see who won that. But in the meantime, we're doing the PA and P scholarship. No, it's not a loss, it's a gain because he's still giving us, he's still giving back, right? By giving away a scholarship tomorrow. So let's see if Mike is on. Oh, P.S. We are going to do, we're going to do tomorrow night. We're going to do the session we had planned for tonight. We're going to just abbreviate it and we're going to do it with tomorrow's. And it's kind of perfect because tomorrow night is actually all sports physical stuff. So it'll be kind of a perfect tie-in and we're not rushed tomorrow. And that way we don't have to rush today so we can completely focus in on what Mike's going to say. Now, one other thing I wanted to mention, this is very, very, very important and key, critical key, okay? Tonight's talk is solely educational, right? And I don't want it to go anywhere political, anywhere negative, because if you know anything about this group, we are not that, okay? This is just going to be a place to talk about medical things, and we're not going to go off the deep end on this one, right? We're going to keep it very educational and light, because, and Mike will kind of put a spin on this too as well. We just want to have an open forum to talk, but please do not go anywhere negative or political because we just won't do that. That's not who we are. Okay, so without further ado, let's see if our wonderful Mike Sharma, who is a PA, ERPA in Dallas, Texas. Mike, are you here with us?
Test, test, test. How am I sounding here?
Amazing as usual. Guys, I got to tell you, you're in for a real treat because Mike Sharma, you're going to tell us all about your history, lots of military background, lots of ER background. He's a national speaker, and he's here in our humble 5-day EKG group to talk about this very important topic. We are so blessed and lucky to have you, Mike. So without further ado, I'm going to pass the mic over to you and kind of just let you take on over and do your thing.
Yeah, I don't think there's anything humble about this group. You got what, like coming up on 16,000 followers here, and you've taught so many people so many things here. I think I've told you already, Jen. I think what you're doing and the rest of your team is doing with this group is amazing, and I'm happy to be able to pop in from time to time here. So thank you for having me again.
Thank you, Mike. I'm so excited to hear what you have to say.
All right, well, I'm going to go ahead and share my screen, folks.
Okay.
All right, so here we go. We're going to talk about Commotio cordis and closure. And that word closure is kind of a loaded word here, and it's going to mean a couple different things during our talk. Let's see here. Let's kind of switch through that agenda real quick. So a little bit about me. My name, like Jen said, is Mike Sharma. I am a practicing emergency medicine PA in the Dallas, Texas area. And I started out in the military's PA program about 12 years ago, I guess, as my professional career started out here. And I knew where I was at in my career. I'd get my deployment orders in one hand and my diploma in the other hand. And so sure enough, the next 6 months found me in Afghanistan, where I was there for almost a year, learned trauma care of combat wounded soldiers and civilians, and worked with a fantastic team of medics, both U.S. and Afghan, as well as my battalion surgeon there in the back corner. I loved the teaching that I got to do in the military, and so I sought that out after I left the military in 2014. And so I have just the real, I don't know, just the humble privilege of being able to lecture to a lot of people I consider colleagues, and work with a lot of people I consider my heroes, frankly. You can even find me on like in front of stages, on TikTok, scarily enough, on some podcasts, and even the podcast that I run with my colleague, nurse practitioner Martha Roberts. But in the end, that's just some of my time. Most of the time, I find myself here in my emergency department, covered in various bodily fluids, muddling along with a terrible EMR, and in a little, cubbyhole where I see patients. So, that's who I am in a nutshell. What we're going to talk about today is Commotio cordis, and for long-time 5-day EKG challengers, you will have heard me give this talk before, but if you're back, welcome. And number two, we're going to put a little spin on it a little bit differently here. Last time I talked, I kind of approached this in this context of this movie Kill Bill, where if you've watched Kill Bill Part 2, there's this thing, this karate technique that Uma Thurman here learns, where she can strike her master or a person in the chest, and they take, a few steps and they die. It just kills them straight out here. Okay. I mentioned that. And then I also showed this video of somebody having a cardiac arrest at a martial arts tournament, but we're going to pass through those right now and get to the case study. And the case study is probably, something that you're already kind of expecting us to talk about here. We're dealing with this young athlete who is known for his passion for youth and his spirit on the field, playing a very physical game in upstate New York. He was struck in the chest and collapsed on the field and went into cardiac arrest. And of course, we're talking about George Boiardi. George Boiardi was a lacrosse player, class of 2004, Cornell University in upstate New York. And while he was playing a game of lacrosse, he was struck in the chest with a lacrosse ball, collapsed on the field, and personnel tried to revive him. And sadly, this story kind of ends more tragically. He died later on that evening. Okay. More of the story on George Boiardi from 2004. This player, Mr. Boiardi, got in front of a lacrosse ball to defend his goal. The ball struck him in the chest, and then he fell to the ground. They tried to run CPR on him. They even defibrillated him, apparently, and he never woke up. Boiardi is remembered to this day with an honorary spot in his locker room. There have been AEDs, these automatic external defibrillators that have been placed in multiple places around the Cornell campus that are hardwired into Cornell EMS services. There are many philanthropic events related to George's causes at the time of his death that continue to impact the community of Cornell to this day, almost 20 years later. Most of you are probably expecting me to talk about Damar Hamlin. And so let's go ahead and watch the Damar Hamlin. I guess we'll call it a video right now. We'll watch kind of his collapse on the field just from a few nights ago. Let me just minimize some stuff here. This is from a website, this Swift Highlights. I have no personal link to Swift Highlights. It just happens to be a place where I found. Is this even the right link? I don't even know. I'm going to find it here. But we're going to pull up this just so we can all kind of have an idea of what we're looking at. Forgive me, the link is not properly working. Oh, I know why. Give me 30 seconds.
Copy that. All right. In the meantime, we got some hashtags going on. If you missed the hashtag to be entered, if you have to be a PA or NP to enter for the scholarship. And so far we have a lot of entrances. Okay, awesome. This is great. We'll be giving the scholarship away at the very end. If you're a PA or NP, this is from Chart Healthcare Academy. All right.
Okay, so I'm going to go ahead and share my new screen. Thank you, Jen.
Yes, yes.
Okay, we should see a football field now. So let's go ahead and watch this hit. So this is Damar Hamlin. I think we see him. Let's see if I can identify him before we see the actual hit. Yeah, so he's right there. We're up 85, and the center of the field is running into him. That's the hit right there. So let's kind of go back, and we'll even play this in slightly slow motion. And I don't mean to do this to be morbid or to glorify what's happening. I think that in the emergency medicine world, the EMS world, sometimes we kind of revel in the terrible situations people find themselves in. I'm not doing that at all. So that's not my intent. So I apologize if that's what it feels like. That's not what I'm trying to do here. What I'm trying to do is just really take a look at the physical injury here and just take a look and see if we can understand it better. So I'm going to play it a little slower speed here. So struck in the chest. This is going half speed here.
It's not what any of us want to see in there.
Okay, so that is the hit on Damar Hamlin. And if you haven't heard already, you saw the results there. Damar Hamlin stands up, staggers around for a little bit, and then collapses in the field. And he is in full cardiac arrest. The EMS teams, the sideline emergency medicine physician, there is one for every NFL team, rush to his side. They start resuscitate him there on the field, and then transport him off to the hospital. From what I understand right now, he's in, what's called stable but critical condition, which is always kind of a funny word for me, like that phrase, stable but critical. I guess he's not decompensating. At the same time, as far as I understand, he still requires ventilator support for his ventilations here. So that's Damar Hamlin. And so let's talk more about Damar Hamlin now and kind of how his tale interweaves with that of George Boiardi. Let me flip back on the old Zoom controls here.
And looks like we have some comments in the chat too, whenever you want to look at those, Mike.
Yeah. So I'm just going to look at him here.
Yeah, and you can do it later. It's no rush.
Yeah, sure. Okay, very good. So let's go ahead, and a lot of these things we are going to go into over the course of my talk here. Okay, back on that PowerPoint slide, I think. So let's continue now. So Commotio cordis is what we're talking about here. Let's get into it physiologically here. It's a Latin phrase here. The idea is this phenomenon requires a blunt trauma, not just anywhere in the chest, but right in the center. And the idea is that it triggers these ion channels, okay? There's these physically sensitive ion channels in the heart that when exposed to pressure, they are triggered. Other things are, chemoreceptors, baroreceptors, whatever. These are pressure receptors here. And when they're triggered, off they go. And I won't say older, but more experienced medics and medical personnel will recall back in the days, the precordial thump we were taught to do if we witnessed someone to go into cardiac arrest. That's the idea, is that precordial thump was based on the idea that there were these pressure sensitive channels that we can resuscitate somebody with. There is the danger window, and you can see how small it is, okay? So for some perspective here, right, the QRS complex, the natural width of the QRS complex is 0.1 seconds, okay? And so if your T wave is, let's just say, maybe anywhere from a half to maybe even double of a normal QRS complex here, we're dealing with anywhere from 0.05 seconds to maybe 0.2 seconds in a standard cardiac cycle. And, your heart's beating about, once a second, once a second, give or take based on your physical activity here. So it's a very, very small window during which you have to get this very specific trauma to a very specific part of your chest here, okay? What you usually see is the impact. There's a few seconds of consciousness and then sudden cardiac death. And these people are straight up dead. They are not just having the wind knocked out of them. They are fully pulseless and apneic. They are in true cardiac arrest here, okay? If there were to be an autopsy done, there would be no anatomical damage here, because we're going to get into other things that can be caused by blunt cardiac trauma. Okay. What do we see here? If a monitor is placed on that person at a time here, you'll see a VFib, and the AED will detect a shockable rhythm if it's placed on there fast enough. What generally happens in these and similar situations here is, like somebody pointed out in the chat window, you can have VTAC for a little while, ventricular tachycardia, and you can be awake and you can be unstable but awake. But that rhythm, if not intervened on, that VTAC will progress to VFib. And VFib, as is often said, is a non-perfusing rhythm, meaning VFib is not pushing O's into your brain, into your heart to keep it going, and you die, okay? You start dying right there because your brain's not getting the oxygen. You go unconscious, okay? If VFib continues long enough, it goes into asystole, and it is not a shockable rhythm, despite what you may have seen on The Good Doctor or on Grey's Anatomy here. So what if we are at the sports field and we see this happen, okay? Or anywhere someone sustains a blunt trauma to the chest. You see someone take a blunt trauma to the chest and they go down like you saw Damar Hamlin go down. You have to get on the chest and you have to get started here. This is never a time in terms of cardiac arrest to think for too long about what to do. It should not take you very long to check the pulse. And if that's not there, if you're not sure if you feel one, there isn't one, and you go ahead and get started, okay? And you might think, well, I'm used to working in a hospital. I don't have all these tools that I usually have in the hospital in terms of drugs or whatever here. But in the end, these people who have sudden cardiac arrest, they need solid BLS, okay? BLS is CPR, and as soon as you can, shocking. And it's not just CPR and shocking, it's perfect CPR, okay? So if you haven't pushed on someone's chest in a while, if you haven't picked out a song in your head that you sing to yourself, right? Because there's all these different CPR songs. If you Google CPR songs, you'll find that there are songs out there where the rhythm is the right amount of beats per minute to get you in the framework of doing CPR. You should be compressing someone's chest at least an adult, 100 to 120 beats per minute. That's the current recommended rate. So there's a lot of songs out there. I think Beyonce's Crazy in Love is one of them. You can do, I think Sexy Back by Justin Timberlake is one of them. So there's a couple out there. Pick your favorite now, just so when you have to, you already have something to go and you're going in the right rhythm. And then again, it's early defibrillation. Those pads go in the chest. And as soon as the AED says we're ready to shock, you don't wait for your first 2 minutes of CPR. You go ahead and shock wherever you're at, and then you keep going. These are the priority, okay? Well, let's say you have an ACLS truck that rolls up, or maybe you're transported to the hospital, and now you are the medic, you're the PA, or whatever else on scene, and you go, oh my goodness, I have all these toys now. Well, what do I do? Well, guess what? These are still the priority, because the more you learn about ACLS, you recognize that with all these gee whiz gadgets and drugs that we have to push, and do we push this or that, or how do we manage temperature after CPR? In the end, what's going to be behind every good ACLS save is good BLS effort. And good BLS effort is perfect CPR and early defibrillation. There was another video that I showed here about this pitcher, this young kid who, baseball pitcher, struck in the chest by a shot back at him from the batter, struck him in the chest. He dies on the field. And a year later, after recovering, he's back on the field, and he's wearing this gee whiz chest pad, this protector sold by some commercial company, saying, hey, this protects against Commotio cordis. Let's kind of shift focus a little bit into the next section. We talked about Commotio cordis. Let's talk about closure now. There's a lot of discussion right now about just what the heck happened to Damar Hamlin. And like Jen hinted at, some of these discussions, as most discussions seem to nowadays, evolve or devolve into different politically oriented sides and public policy, and whether this leader should have done this or that leader should have done that, and so should fire and be resigned, or whatever else here. In the end, I think it's more important for us as clinicians to have a real even keel here. Because you may be the most medically smart person that your family knows. And maybe that thought scares you, because you're like, well, I'm for sure not the most medically smart person that I know. So like, I'm always asking other folks for advice here. So the fact that people are coming to me and respecting me, why would they do that? I'm just a lowly fill in the blank, NPPA, medic, physician, whatever else here. But wherever you're at in your training, you might just be starting out as a student nurse or a baby EMT, okay? But you may still be the medical authority in a lot of people's minds here. So number one, take a real even keel, because when you have blunt force trauma to the chest, that can be a lot of things. So Commotio cordis is one thing, but you saw how narrow the window is for someone to suffer Commotio cordis. So timing, just the sheer happenstance of it, dramatically lowers the likelihood of this being Commotio cordis. Okay. And just how rare it is in general. I mean, like, sudden cardiac arrest in general is quite rare. So for a very rare reason for sudden cardiac arrest to be the for sure definitive reason, we finally saw one sudden cardiac arrest on the field in, how many decades of NFL football. Okay. I think it's a little premature here. Okay. I was having this discussion when this talk was coming up about with a colleague of mine about how, we had friends who were so sure this Commotio cordis. And the last thing I want anyone watching, the last thing I want you to do after watching this talk is, I know what Commotio cordis is. And now the next time I hear about somebody coming in from the sports field who had a physical blunt trauma and went down, I'll know it's commotio cordis that'll act appropriately. That's the last thing I want anyone to think, because we know that there's so many possibilities here. Okay. Now, it could have been, let's say, some sort of pericardial effusion. Unlikely someone would go into like they were playing at NFL level caliber like efforts, and then all of a sudden their heart sac is filled with fluid and they go down because of that. That's unlikely. Okay. Could there have been some sort of like a bruising of the myocardium? So a true like, myocardial bruise. Like that's a possibility as well. Could there have been some sort of like a physical like tearing, like God forbid something like actually physically the integrity of his heart ruptured or something? Yeah, maybe, but like he wouldn't still be alive if that were the case. I haven't heard of him going off to surgery, have any sort of crazy repair going on there. So that's less likely. Aortic dissection, or aneurysm. Again, like maybe that's the possibility and they're managing it medically. Like that's a possibility here. So there's just so many possibilities here in terms of what could have happened to Damar Hamlin. So I think it's important to be careful here. And that kind of plays into some other things too, some of these assumptions. We watched this video and what did you see? Okay, well, you saw a person get struck in the chest, fall down, stand up, walk around for a few seconds, and then pass out. Okay. And without even thinking about it, we kind of assume a couple things here, right? Okay, well, that dude looked like he was strapped up to go to combat against like a medieval dragon or something. NFL players have so many pads and guards and helmets and whatever else. How could anything possibly, traumatize the contents of his mediastinum here? Okay. And he was playing an NFL game. So like, obviously he was a healthy guy in general. He had no medical issues. He was obviously well, things like that. Well, let's talk about this, right? So digging more to the George Boiardi story, right? This interview back in the day of lacrosse players talking about their protective gear. So this is a lacrosse player, a contemporary of George Boiardi's. And what did he say? Well, I don't get checked when I go on the field here. And so because I want to have more freedom of mobility and speed on the field, I cut the bulk of my pads out. No one checks them. Okay, so we think these people are all duded up for combat here, when in reality is maybe there was some deficiency in his pads, maybe a crucial part that would have diffused force away from the chest had been removed, or maybe just defective. We don't know that, okay? In terms of the player's health, we don't know if Hamlin had been ill previously. We know even having things like influenza, the flu, just having the innocent flu increases your risk of having an MI or cardiac arrest for probably a good month or two after having the flu. It's flu season, especially in Buffalo, and so it very well could have been he was sick recently. He's trying to play through it for his team, and that predisposed him to something there, some sort of pre-existing myocarditis, just a very mild subclinical that when you stress the heart to the degree that you do in an NFL game, now it goes from subclinical to clinical, okay? Even things like George Boiardi. George Boiardi was this guy who passed away in 2004 and from commotio cordis, and now there's AEDs everywhere, and so people on Cornell's campus are protected against commotio cordis as best they can, except Boiardi never had an autopsy. So we have no idea whether Boiardi, who has been elevated as this person who died from commotio cordis, even had commotio cordis. In fact, I can't find the original article here, but one news report says that there was some bleeding, which is not what commotio cordis is. Okay, commotio cordis is a lethal arrhythmia. from arrhythmia. It's not from some sort of big trauma here. And this is echoed by one of Boyardi's coaches who said, I saw a lot of bruising on the body and he was bleeding on the field here. And so that doesn't even match up with commotio cordis, right? So we have this person who died darn near 20 years ago. And a lot of people think they know what happened here, but in reality, we still don't know how George Boyardi died. So in the end, I think it's really concerning when people are so definitive about what happened to Damar Hamlin. And it's really important for us as clinicians, when we talk about this, that we use a little kind of like, hey, let's slow play this a little bit. We don't know what we don't know. And number two, don't let it guide our thinking. Okay, there's things like recency bias. There's things like premature closure, all these things that how we as clinicians get tripped up. And so the next time you have someone who comes in, young person, cardiac arrest, this story's in the news, be careful about it. Don't let it cloud your thinking here. Just to sum up here, chest protectors exist. It's unclear whether they work or not. A lot of studies show they do not work that well in protecting the heart here. One thing that testament of Boyardi's death, I think important, is training athletes and coaches, because how did Boyardi die? He put his body on the line, literally. He got his chest and spread the biggest part of himself out in front of the goal and allowed this lacrosse ball to strike him in the chest. He participated in his own death, sadly enough. Okay, and so what's happening now is people in ball sports are being taught, do not open your chest up to the blow. Turn away, show your shoulder, show your side, show your back. Don't open up your front of your chest because you could have this commotio cordis. I think where we can go from here is we can also be pushing more for AEDs. I don't know about you, but when I'm in a big public event, I go to a concert, I go to church, I go to wherever here, I take a quick little look about where the AED is, okay? Because if something goes down, that's not when I want to be thinking about where the AED is. When I've got to put hands on chest, I don't want to have to think about how fast do I push and what's the song or whatever else here. I know exactly how fast I push, what song I'm singing, and I've already scoped out the AED ahead of time. So I kind of prepare ahead of time here. That preparing ahead of time allows me to recognize problems and initiate care easier. Again, we need to make sure we're avoiding things like premature closure, closing our mind off to other possible diagnoses after someone is having a sudden cardiac arrest in the field here, and practicing metacognition, this practice of thinking about our thinking. Okay, if we were one of those people who really jumped on the commotio cordis bandwagon a couple days ago, okay, that's cool, but think about it. Think about why you might have thought that. Ask yourself, if you really now having to place a bet, would you place a bet as aggressively on commotio cordis now that as you did 2 days ago? And if not, why? And can you recognize any sort of meta behaviors, meta thinking behaviors here about that process? How can that inform your future patient care, your future thinking processes here? Quick plug for me, if you liked hearing me talk and talk about medicine, I do a lot of that. I talk on the Two View every month. This is our podcast with NP Martha Roberts. It's Two Views on emergency medicine. We go into urgent care topics as well, because I'm also an urgent care practitioner here. You can find it on all your major podcatchers as well as going on YouTube. Personally, I resisted the, I guess before I get into this here, any questions right now before we kind of wrap up?
Yeah, there's actually been a ton in the chats. So maybe you could answer the Facebook.
Yeah, gotcha. Okay, so I can't see the Facebook.
Right,
I can get into the Zoom. So let me just go down the Zoom chat here, okay?
Perfect.
There have been a lot. Wow. Okay, I don't know. I was looking for the little the icon. Okay, here we go. So we'll just go quick. I'll go rapid fire here, and I'll go back later on for the Facebook, and I'll respond by typing out some of these answers. Okay, so I'll just go quick what I can do quickly, and then I'll respond more in detail later on here. Okay, so Jill Lenovo, Commotio versus contusio cordis, okay? Commotio cordis is a lethal arrhythmia versus contusio cordis has to do with actual bruising of the heart tissue. So bruising implies more persistent damage, swelling, some bleeding into the tissue there. That's the big difference there. Not sure the accuracy. I read they achieved Ross and he arrested again. Sure. I mean, we've all had these patients who we revived and then they died again, sadly enough. So yeah, I don't think having to resuscitate again rules out or rules in commotio cordis. It doesn't look like it was that bad of a hit. I was just talking to someone about this a few minutes ago. It's not about the force of the hit as much as it is the exact timing. And again, was his heart presensitized by, take your pick. He was dehydrated already, and so maybe he was a little bit off on his electrolytes. Maybe he was ill recently. Maybe he had some sort of congenital heart condition. And I was reading more about the NFL medical exam. And yeah, sure, it involves an EKG, and for some it even involves a stress test. But none of these things, we know none of these things are 100% sensitive to catch all the different weird stuff that can happen in people's hearts. So yeah, I mean, like, sure, there are some things that are done to screen people. In the end, I'm less concerned about the force of the blow, because it's funny, you'll hear about some folks say it wasn't that hard of a hit. And other folks say, I would have been freaking dead if I got hit like that. So I guess how hard it is of a hit is kind of based on what your experience is with physical violence previously. But I think it is one of those things where it's more of a right place, right time than severity of force, that sort of a thing. Okay. Is it always VFib or sometimes VTAC? I mean, these people are supposed to be pulseless and apneic, and I suppose you can be pulseless and apneic and be in VTAC. In the end, they're in a shockable rhythm of some sort if you catch them early enough. That's the idea. Could the cause of the event be due to the stress the heart is under at the time? I think what Ron said is yes, exactly. Like, so many other factors could be going on there that we don't kind of step back and think about those other factors, then we kind of lose a lot of stuff there. Okay. I understand the further comment from Jules Lenovo here. There's a lot of reasons for myocarditis and pericarditis, and I'll just leave it at that. Okay. I think that all vaccines, there are that small fraction of people that have some sort of adverse event from vaccines. Okay, like people get Guillain-Barré vaccine after Guillain-Barré syndrome after having vaccines. People get other weird stuff after having vaccines. Okay, but those things also happen after viral illnesses too. So yes, there's many possible reasons for myocarditis. I think it frankly does a disservice to people who are truly injured by vaccines, and there is a small percentage of these people, and it varies based on demographics and pre-existing conditions, et cetera here. But we have to recognize as clinicians that whenever we do something to somebody, there's always a possible risk. If I just give ibuprofen to somebody, there's a possible risk. I took care of a patient recently who had a GI bleed, a pregnant patient with GI bleed. And I was like, wow, like a young lady, no history of, alcohol use heavily, her liver is fine. I was like, why do you think you're having a GI bleed? Are you on any sort of medications? And the lady said, yeah, I'm on aspirin every day because I had COVID earlier in my pregnancy. And so my OB wanted me on aspirin to prevent me from having a blood clot. There is always that potential second order effect. And we know GI bleeding is a potential second order effect of aspirin. So sometimes you have to roll those dice, but it's important to recognize these are somebody else's dice we're rolling. And it's important that we honor those people and say, hey, I see the injury here, and we need to treat it seriously and appropriately. At the same time, you could apply everything we said in this discussion to any of that in terms of this, this happened and then some sort of other medical thing happened. We are a storytelling race. And so it's natural for us to see two events, one before the other in time, and want to try to draw a conclusion, some sort of link. In the end, that hit that Damar Hamlin took could have had nothing to do with this sudden cardiac arrest. It could have just been the timing of it. And maybe if he didn't get hit, if, a butterfly flaps its wings in Japan and, that downstream effect is the ball carrier runs left instead of right and goes around Damar Hamlin, who's to say Damar Hamlin wouldn't have still fallen down from cardiac arrest right there in the field? It's just frankly unclear. Okay. And so it's really important that we just don't get too passionate about these things and don't tie them to our identities and who we are. In the end, these are all just academic topics for me. And if in the end I'm proven totally wrong about this thing or that thing that I've been doing for a long time, I'm confident that I was doing them with the best evidence I had at the time. I was in the place to do those things and I did them. I have to own the bullet, as they say in law enforcement. Every bullet I fire, I have to own that. And I feel pretty confident in what I've researched here, that what I'm doing when I do something is right at the time. That's a lot there. Let's move on from that. How big is the thump area on the chest? It's not very big. You figure this is the size of a regular person's heart. Okay. And some people's chests are bigger than others, right? And so there's a lot of real estate on a chest. So you got to hit him just right. Now, if you look real closely, you see that the ball carrier dropped shoulder, and it wasn't a chest on chest. Because if you go chest on chest, you're spreading the force out left and right here. The ball carrier kind of turned in, and so that force was actually a little more concentrated. If you think back to your geometry days here or your chemistry days here, the amount of pressure has to do with the surface area. And so because the shoulder was turned, surface area was reduced, force, it was increased here. So maybe the thump area was big enough for Damar Hamlin. How will it be definitively determined? I don't know if it'll ever be definitively determined. Mm-hmm. I don't know. Sometimes this just kind of happens. You can read, and you should read about, by the way, great tales of a patient and a bystander. There's this physician called Dr. Glockenflecken, and Dr. Glockenflecken is a freaking hilarious, frankly, ophthalmologist. Yeah. Funny dude here. And he does great Twitter and TikTok videos about the state of medicine here. He died. His wife woke up next to him in bed and he was having agonal breathing, young, healthy dude, no family history of cardiac arrest or early CAD. And you can listen to the 911 call of his wife calling 911 and saying, "My husband's in bed with me and he's breathing funny. I don't know what to do." His wife, she's earned diamond earrings every year for the rest of her life, in my opinion. His wife did CPR on him for 10 minutes while she waited for the paramedics to arrive and take over efforts here. Okay. I'm usually spent at about 2 of CPR. Okay. So either his wife is like a freaking superhero. I guess his wife is a superhero regardless. Okay. So and in the end, so that happened. He's a physician. He knows all the questions to ask. He's gone to all of his follow-ups here. He has no idea why. He just a young, healthy dude, just had sudden cardiac arrest in the middle of the night. He has no idea why. So how will it be known for Damar Hamlin? TBD, to be determined. Curious how effective the chest protector would be for a baseball player. Again, so there's kind of the kind of technology is really important. Okay. I'm still scrolling down here. They said that he had a pulse but was not breathing. I was told he was defibrillated. So if he was defibrillated, I would hope he didn't have a pulse, because those two things should not go together. agreed with previously undiagnosed congenital heart condition. NFL physical, as rigorous as it is, just it's impossible to catch everything. Okay. Could this be a viable reason? This is up my alley here. Could this be a viable reason we don't see this type of injury in the Army while soldiers are wearing body armor and ballistic plates? Well, maybe. So, speaking from experience, more penetrating trauma in the Army in combat operations than blunt trauma. I'm more worried about an IED blowing up under my feet and sending razor sharp fragments into my genitals and my legs than I am of a car just coming out of nowhere and hitting me on the battlefield. Okay, so like there's just different wounding patterns going on here. Blunt trauma, a lot less of a factor in combat operations here. Okay. Dehydration, agreed. Adrenaline helps or hinders. In the end, I think epinephrine is an adjunct. The life-saving things are perfect CPR, and perfect is a standard to which even professionals do not achieve often, in my opinion. And early defib. Autopsy was not done. How about something small like a paintball? I feel like that's a little bit too small. There's just not enough force there. But I'm not sure about that one here. Magically unknown WPW, Jessica Swingen's comment here. I mean, I guess you could have WPW that was not recognized in an EKG, but these, I mean, think of how much investment it is to hire somebody for your NFL team. It's a huge investment. And so these people have cardiologists, internists, orthopedists on staff to do these NFL combine physicals. So like generic WPW, Brugada, etc., I would think would have been caught. Okay. I'm continuing to scroll here. Jen, your comment, I'm going to read this here. So further diagnostics, I think you were saying they could do an echo to look for pericardial effusion. I love that. And so that effusion could have come from the initial impact, or also it could come afterwards as well. And so again, even if you find an effusion, how sure are we that it happened immediately upon impact versus later on? That's kind of hard. Cardiac MRI, I agree. Yeah, there's a lot that can be done here. And ultimately, we're not privy to Damar Hamlin's medical information. So might it come out for various reasons? Sure. But again, we may never know what's going on here. Scrolling. I love this. Robert Hildreth. Everything we do is a result one way or another. When treating someone, we're always looking for the optimal one, knowing we might not get the result we want. That's the truth. I have to accept that every time I give someone an antibiotic, I may cause them to have, depending on what I give them, I could cause them to have a tendon rupture. I could cause them to have neurological damage later on. They could have anaphylaxis. I have to own every single one of those little bullets that I prescribe, BID for 7 days. And I have to be okay with that sometimes. Jessica Swingen echoing about that Dr. and Mrs. Glockenflecken. Yeah, that's great. It's in the chat. Dr. Glockenflecken. Look for him and Lady Glockenflecken. Listen to that EMS call. It's just crazy. Yeah. Will Flannery, Flanary, is his official birth certificate name here. Mike, you may have mentioned this, but at what point in time must an EKG be performed to see the changes after commotio cordis has occurred? So, I mean, if you do an EKG right away after the lethal arrhythmia starts, you'll see it. Like you see the VTAC, the VFib right away. The person won't be down and in arrest with the normal, well, I take that back. I mean, I suppose you could have like pulseless electrical activity, so like it very well could be someone could be in full on DED dead cardiac arrest, but still have a normal looking EKG or a normal-ish looking EKG. It's possible. But if the question, if I can tweak it a little bit, if someone's going to have VFib or VTAC, you probably see that pretty quickly. As you see, these events all suggest you get hit, and 3 seconds later, you're down on the ground. So you'd probably see VFib, VTAC pretty quickly if you're gonna here. Increase in cortisol levels in the body play a factor. Of course, anything can be a factor here. Does commotio cordis end up being one of the rule out others versus a definitive diagnosis with specific findings from Cheryl Popovich goals? So yes, so commotio cordis is thought of as what's called a diagnosis of exclusion. And that phrase you might have heard before, but if you haven't, what that means is you look for every other reason first. You cross every other possible reason you can think of first. And then what you have left is question mark, maybe commotio cordis. That's kind of where it goes. You have to look for all the other reasons and cross them off first. Okay, that is the end of the chat. I'm happy to come back on the chat later on and review for any other questions here. I know this topic is kind of an unusual cardiology topic. It's on a lot of people's minds, so I'll come back and I will answer other questions later on if I can. Okay.
Thank you, Mike.
Yep. In the end, I'm going to close with words from Greek philosophy here. Okay, and this is. You know, I don't think I'm really that smart of a guy, honestly. I just kind of follow where the evidence goes and I work hard. In the end, though, Socrates recognized he was the wisest man alive. And why, he said he's the wisest man alive because he knows just one thing. And that one thing is that he knows nothing. He knows that there are so many other things he is not aware of when it comes to making decisions or thinking about things. I think it's super important for us to keep the words of Socrates in mind every time we step out on the floor or board our ambulance for that next call. Thanks so much, Jen. Thanks so much, challengers. We'll see you next time.
Thank you, Mike. And what a wonderful presentation. But definitely don't go because we're going to talk about the scholarship winner. And Mike, again, thank you so much. You guys can find other lectures by Mike in the 5-day EKG challenge group. They are all in the bonus section. He's done a lot of really fun things for us. He's kind of our pop culture. I would say you're our pop culture specialist, right, Mike?
Sure. I mean, I'm no Mandalorian or person like that. But yeah, I like to. I skew more 80s, 90s versus current. So like, I go back in the old times, the classic pop culture, the 80s and 90s.
Yes. All right. Awesome. Okay, guys. Well, I'm going to go ahead and talk about the scholarship now for winning. And Mike does in the future, he's going to teach in the 30-day EKG challenge as well. So we'll be looking forward to him doing that.
Love it.
He's been a frequent guest in our 5 days. So again, can't thank you enough for your time, Mike. We'll see you soon. And if you want to stick around, I'm going to show with you the scholarship, and I'm also going to do the winner. And this is sponsored by Chart Healthcare Academy. They are graciously giving away a scholarship. So let me tell you what that looks like. So in the meantime, let's do the giveaway. All right. And again, if you're in the 5-day EKG group, please, let me actually stop this. Please go ahead and ask questions to Mike in the 5-day EKG group if you still have them, because he's not going to be able to see them on the current Zoom. Okay, so let me share this with you. So our scholarship winner tonight, and it has to be a PA or NP. Yeah, Remy's going to come back in a second. You're going to win access to our 30-day EKG challenge. And Jessica, thanks for being here too. I know you're EP and having your expertise is so helpful. You're here even with COVID, which says a lot. So this is Remy. He's giving away a scholarship. So let me just go ahead and put up what you're going to get. So the hashtag to win was chart. I have your names in the bowl. I've been writing them down while Mike was on. You're going to get access to a full 6 months with us in the 30-day EKG challenge. And what we're going to do is we're going to start out Monday, January 9th. So you're going to get basic EKG terminology on the 9th. And then we're going to go ahead and do a basic hands-on 12-lead class with Michelle. And then we're going to do basic rhythm interpretation with practice, kind of like what you saw with Gary. And we're going to do all that in a Facebook group and on Zoom, just like this. And so if you are winning, what you'll need to do is you'll need to get me your email address so I can give you access to the learning portal. And you also want to give me your actual mailing address so I can send you the kit. Now, before I share my screen, let me show you what's in this kit. So this is a box that is, okay, bye, Robert. This is a box that's going to come to you as a welcome gift. And what you're going to get inside of it is, if you saw Gary's lecture, you saw his tool, you're going to get one of those to have, and you can use it to look for ST elevation. You're also going to get a workbook full of real EKGs that we're going to go through together. This is going to come your way. So if you're winning the scholarship tonight, you're going to get all of these things. You're going to get crayons that are going to be sent to you so you can color code the EKG that we're going to send to you in this box. You're also going to get a cheat sheet that has all the things like how to find axis deviation, how to find semi-mimics. And the best part, I think the best part, is you're going to get, in addition to all of that, a little mini painting that comes on the easel. And all of these are handmade. Okay, so this particular scholarship winner will get the one that says believe. So they're all kind of brightly themed. Okay, so this is going to be mailed to you, and we're giving away a scholarship tomorrow night. So if you don't win tonight, there's always another chance tomorrow. And like I said, yeah, it's really super fun. Nikki, I know you've been around for a long time, you know. So the winner is going to get, like I said, access to the Facebook group. These are some of the classes. We've just added a couple more so you can see what the schedule is like. And you're going to get to go either to the live session if you want to, or you can watch the recordings. We're going to start out on the 9th with a welcome call. We actually run this all year long. So one of our nurse practitioners is going to do an OSA talk that she's already got planned. It's part of our year-long program. But then we'll start off with our new cohort of class, and we'll start off on the 9th with welcome call and EKG terms. Okay, so we'll show you around the group. We'll show you where all the lectures are and how it's just like this, but basically it's a smaller group of us. We'll do it with Michelle Barkley, our wonderful, she's like our cheerleader in this group. And you met her. You're going to meet her again tomorrow night and Friday night. She's going to do games for us before we do our class. And we're going to do a 12-lead workout, and she's very visual. Then we're going to do basic arrhythmias. We're going to do practicing the 12 lead together. And this is all basic stuff here. And then we're going to cap that off with using the EKG that are in the box. We're going to work on those together in like a co-working session on the 21st. And of course, all of these are recorded. If you have commitments, no problem. We also have a study hall on the 23rd. And basically that's where we're going to come in and talk all about anything you want. Okay, so if you have a topic that you want us to cover, we'll do a study hall on that. And then on the 31st, we're going to do chest pain cases. And yes, Regina, you do have a painting that says regardless. And we also have a bunch of classes that are for CE. Okay, so we have 12 hours of CE for medics, EMTs, RNs, NPs, and PAs. And it's based on all of these classes, which are already recorded and in your learning portal. And you'll get access to that as our scholarship winner, of course. Okay, you'll also get a chest pain guidelines update with our cardio NP, Megan. That's already recorded. Additionally recorded stuff. Somebody was asking me about stress testing tonight on the chat. This is actually something we cover in the 30-day. We also have an RN who took us behind the scenes, or sorry, Melissa PA. She took us behind the scenes of the cath lab and showed us images and what to look for. So this is kind of a cardiology theme, extra bonus stuff. And then we have our coach, Mike was talking about David. He's our EKG Mandalorian, and he does study halls as well, where he takes EKGs that you've sent in and he dissects them for you and walks you through it. And you can ask him questions live. Okay, so you're going to get access to those as well. There's usually one every other week. And then you also get, this is our wonderful Carissa. She's our sleep NP, and she does a lecture on obstructive sleep apnea. And then we also have our lipid queen. This is Whitney, and she's doing once a month a lipid cases presentation for us. So she talks about how to get the new meds covered, how to look at a lipid panel. So these are all just extras on top of the EKG classes. And then we have Gary coming back doing a presentation as well on the 24th. So lots of stuff. And so you're going to get access to that. So I'm going to go ahead and do the drawing. So excited. And if you don't win tonight, again, we're giving away one more tomorrow. And that is going to be for our Helpful Citizen Award. And we'll do that tomorrow after our lecture. But tonight's Chart Healthcare Academy Scholarship winner. I know, Nikki, you have the drum roll playing for me. Okay, let's see. All right. So winner. Let's see who is our winner. You can tell I need my glasses. Our winner is Pam Colson. So Pam Colson You are the winner of the Chart Healthcare Academy Scholarship. So congratulations. Yay, Pam. So make sure to message me in Facebook Messenger, Pam, with your address so I can mail out your kit and your painting and all your cool EKG toys. And I'll get you access to our Facebook group where we have all the classes live. So congratulations. I'm so excited for you. Okay, guys. So thanks for all being here. We're going to come back tomorrow, same time, same place. And if you don't win a scholarship to our 30-day EKG challenge and you do want to join us and you're like, yes, you are the tribe for me. You are people that care. You are people that want me to win. You are people that have EKG knowledge and will mentor us through it in a group session. Tori's dropping the link to join us. You can join us as a student at the student rate, which is only $127 for 6 months of access, okay, to everything we do, all right, in the 30-day group. And then you also get a kit. If you want to join for CE, you choose your job class and it gives you the price. But it's very, very, very low investment, and we are increasing the price after this challenge. So if you are thinking about this and you want to join us, definitely get in. It is a awesome place to be. It's just like this, but like on steroids. We have classes all the time. Not that they're all required. You can join what you want and kind of choose your own adventure, of course. But we have something for everybody. We're really excited, and we will see you tomorrow. Okay, so one other thing I just wanted to say is that, yes, it is a supportive group, and Melissa Mainville is in that group with us. We love her. So one thing I just wanted to mention is you guys have been so far so full of energy. You have been contributing so much, and we really, really, really appreciate that. So just as much as you probably love learning from us, we love hanging out with you guys. So it's really, really fun, and thank you for honoring us with your time. Okay, and Michael, thanks for your extra comments on the military aspect. That was awesome, and thank you to Mike Sharma. And we will see you guys tomorrow. All right, bye guys. Have a good night.